Hi, my name is Lindsay Liben. I received a question from somebody who is currently pregnant but had suffered a miscarriage at an earlier point, and they were concerned about the amount of anxiety that they were experiencing. They felt it was a little bit magnified by the lack of support from some of the other people around them. So I wanted to address some of these questions and concerns about how to cope a little more effectively after you've had a miscarriage, and also processing some of the grief. I think we live in this death-denying society that really doesn't carve out space for someone to process and work through an invisible loss, which a miscarriage can sometimes be. Part of it is that we don't have this lifetime of memories to celebrate. And so it almost feels like you're kind of grasping onto this very short connection. And it is an out of time loss. So there's really no playbook. There's no way to kind of figure out the best steps forward, which is why sometimes people, while well-intentioned, may say, oh, just get pregnant again. But that doesn't really help with the grieving and bereavement process. And part of what needs to be addressed before you can establish healthy boundaries with other family members is really working on your internal grief process. I think some of the anxiety, while it's very uncomfortable, it does speak to the maternal attachment to your unborn child and how you are looking to bring them into the safest and healthiest environment, which is why it's necessary to work on yourself first. As I mentioned earlier, it is an out-of-time loss, and there's few concrete signals other than perhaps a few ultrasound appointments, and just kind of these fantasies of yourself as a mother that we look to while we are grieving. So I think from an evolutionary standpoint, it's healthy to recognize that grief really exists as this opportunity to reflect on what happened. And from a psychological standpoint, it's really healthy to let the bond sort of forge in this new way. It's not about erasing what happened. It's about integrating it into your experience. You will be changed as a result of this, but it doesn't mean you'll be changed for the worse. Sometimes with some of my patients, we talk about how to continue the bonds. It's okay to love in the absence, and sometimes that can take a concrete form. Like sometimes we'll suggest planting a flower. If you have the space, planting a tree, but something that you can look at and you can reflect on what happened. It was real, it was important, and it was something that can stay with you. Another suggestion might be if you look to any of your religious or spiritual beliefs, what type of ceremonies or what type of programs may exist to acknowledge that this was something that was real. I think part of it too is really just giving yourself the space to have your feelings. From the anxiety perspective, it's very necessary to embrace anxiety as a signal, an alarm that there's danger ahead. Now, that may sort of interfere with how you're living your life. And so sometimes it may be necessary to speak with a medication provider or a professional counselor or a therapist who can help you unpack some of these underlying concerns, do a little bit of reality testing, and help you come to a place where you have more tools in your toolbox so you can respond to the anxiety more effectively. Also, if you have a history of anxiety or depression, sometimes these get magnified during pregnancies, and then it's so necessary to deal with it so it doesn't cause this spillover into after the baby is born or into subsequent pregnancies down the line. I think just the awareness that you're asking this question of how to deal with it signals a healthy response that you are aware this is a concern, that this is allowing you to exist in a way that may not be attuned with your level of comfort, and you can actually do something to deal with it. So I really encourage you just to be as patient with yourself as possible, be attuned to your feelings, look for triggers in the environment. What is fueling that sense of disquiet, unsafety? And that may be where the anxiety tends to manifest. So if you can kind of work through those underlying causes, it may prevent them from really existing in such an intrusive way in the present. So I certainly wish you the best, and thank you so much for reaching out. Take care. Bye-bye.